Ethiopia is one of the largest countries in Africa, estimated population of 120 million people. There are only 200 dermatologists in the country. In the eastern Ethiopia, where I'm practicing now, there are only 9 dermatologists for more than 34 million people. Almost 80% of our people living in a rural area, getting a specialized care provided by a dermatologist is very, very limited. These access barriers are especially concerning given the high prevalence of tropical skin diseases in Ethiopia, many of which are either preventable or treatable if early detected. It is known that these most common conditions like fungal and bacterial infections, parasitic infestations, and skin-neglected tropical diseases thrive in a setting where there is a limitation in resource and healthcare. The main challenges in providing dermatological care in Ethiopia are a limitation in healthcare system and the skill gap in frontline healthcare workers, so they cannot treat the common skin infections and other skin diseases in healthcare like the health post and health centers. It was on 2022, I first saw the Gloderm mentorship program application. This Gloderm mentorship program is focused in creating dermatologists that are change makers and leaders in the community. Fortunately, I was selected as the first group of mentees. Personally, this Gloderm mentorship program has given me a chance to be a better leader, a change maker, and a skin health advocate in the community. Following the Gloderm mentorship program, I was awarded a Gloderm CeraVe Care for All Access grant. With this grant, we were focused on 2 main activities. The first one is training of frontline healthcare workers for the early diagnosis and treatment of leprosy. So far, we have trained 60 frontline healthcare workers so they can prevent the disability that is affecting our people. The second activity was a community outreach program. We have tried to reach more than 3,000 people in the community to show them that leprosy is not a curse from God, rather it's caused by a bacteria which is preventable and treatable. Our country, Ethiopia, is among the top 3 countries in Africa and among the top 23 countries globally with high leprosy burden, usually reaching up to 2,500 cases annually. But because of our efforts, now we are seeing some changes on the attitude and knowledge towards leprosy and affected individuals. We have a long way to go, but we will keep fighting against the stigma. Before 2023, there was no any dermatology training centers in Eastern Ethiopia. And for this reason, we have launched this residency program on May 2023. The major challenges are training our residents in subspecialists, specifically on dermatosurgery and dermatopathology. With the help of the Gloderm CeraVe Seed grant, we are able to invite guest dermatosurgeons to our university to train our residents in person.
Training in eastern part of Ethiopia is really transformative because dermatology in resource limited setup, you have to rely on the clinical judgment. That means detailed history taking and thorough physical examination. And in addition, training at Bisidimo Hospital exposes me to a wide range of dermatologic cases. And sometimes when you treat complex cases based on just only your patient's history and your knowledge and with your team, it is a lesson that you don't get it in a textbook.
These residents, they really are a skin health army. With their commitment to community dermatology, they have managed to visit prisons, orphanages, elderly houses, and public areas. It's my hope that after finishing the residency program, the residents will go back to the different parts of Ethiopia and beyond Ethiopia to the neighboring countries, and they'll become a change maker and help improve the skin health in their communities.
After my residency program, I plan to work in public sector because the need is high there. My first priority is to develop this teledermatology service because in order to reach this dermatology care to remote and underserved populations, this service approach is very important. In the long term, my ultimate goal is to have a dermatologic care equitable and accessible for all Ethiopians who need it.